Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter.
Welcome to the Mind Myself podcast. I'm Esther, founder and CEO of Mind Myself, and it is my great pleasure to welcome Zora Pesio to our podcast today.
Esther, thank you so much for inviting me. I'm very, very appreciative to be on your show.
Fantastic. Well, just tell us a little bit about who you are, your credentials, and why you love doing what you do.
Okay. I'm a country girl. I grew up way out in a little teeny tiny town in Oregon, became a candy striper in high school and found out that they offered scholarships to nursing school. So that's how I started my career. And I particularly remember one of the nuns who is called Sister Mildred, and she would always tell every patient, be sure that you wash behind your ears. And you're like, what? Anyway, it was just a wonderful learning experience. And so with that, I've gone on. I now have a master's degree from the University of Texas Health Science Center in Houston. And women's healthcare is my big passion. I also really am interested in prevention. What can I do to keep you from getting sick? What can we do to treat things beforehand? Let's get you on supplements instead of off medication. Yeah, I think I said that right. So get on supplements instead of medication. And I enjoy prevention. I love education. Teaching is one of my big things that I really, really am appreciative that I'm very good at. And just talking to people that will listen and really want to learn about their bodies.
Well, that's awesome, because if somebody's watching this, then they want to listen. So today we're going to talk about urinary incontinence. We hear that term bandied around, but we're going to talk about it specifically in terms of perimenopause, menopause, and postmenopause. So what is urinary incontinence in those three phases of a woman's life?
Just basically, to boil it down to one, it's urinary leakage. And why? Young women, they've had several children, their vaginal muscles are kind of getting loose and the ligaments are not holding the bladder where it needs to be. The bladder is not as tight as it was, it just kind of relaxes. And so stress incontinence is if you cough, sneeze, stand up, walk, move, turn over, anything like that, you can have a little bit of leaking. And that's always really embarrassing. And it's like, equated with, oh my gosh, I'm old. But there's a lot of genetic things can happen. Many things can go on with the bladder. Like the big one, I have to scold most people, you are dehydrated. So when your urine gets really acidic, it really kind of hurts and you have a little bit of urgency. And then with a little bit of urgency, then you leak. And so the recommended amount of fluid every day is half your body weight in ounces of water a day.
Wow.
Okay, so that will really help with the acidic bladder, which is one of the causes of that. Again, if you want to go out, you're playing with your kids, they go, come on, mom, let's go on the trampoline. You're like, oh dear. So you just do the best you can. And that's why if you look at Target or wherever, any store, look at the whole line of all the feminine products. And most of them are for incontinence. And so it's a big moneymaker. And
for sure. And so why is it such a big thing these days? We never used to hear so much about it when I was growing up.
Well, women never talked about it before.
Yeah, I was just going to say, maybe nobody was talking about it, but now so why is this so prevalent and so common among women?
Boy, I think the big one is that people are now talking about everything. I mean, women talk, you go out with your girlfriends now, the stuff you talk about, your mother would never think of even thinking, let alone talking about in public.
I'm so happy we're starting to talk and have the conversation. Yay.
Yeah, exactly. And again, like I said, someone who's had 6 kids, it's like, oh my gosh, yeah, I leak all the time. So then they go in and they're better candidates if you have to for surgery or for, again, some of this PRP that we can inject, which is protein rich plasma. So when you draw blood, it's the part that spins down into that golden yellow liquid. That's pure gold. And sometimes if that's injected into the area, that can stop urinary stress incontinence. And then when you cough, you sneeze, you do anything, again, the ligaments, are there exercises? Everybody goes, well, do your Kegels. Well, you'd have to do 500 Kegels a day to even become close to getting the muscles where they need to be. Can you do it? Sure. What are some other reasons? There's a lot of new things. There's a lot of new machines. There's a lot of new instruments, I would guess you could say. There's several things that you sit on a chair and it vibrates and it constricts the vessels. Those are new. It constricts the muscles, I should say. There's lots of things that go into the vagina. And so that's becoming part of the whole plastic self-care industry also. And as much as I hate to say, they work. And they work really, really well.
So how would a woman know what to try first?
Most women will try like panty liners, if you're just leaking a little bit, or then they go to something a little more heavy duty. Some people wear the women's undies. Some people wear the ones that are washable. They've got all kinds of things out now. And so finally you just one day you're like, I'm done. I have to get this fixed. You've just reached your limit. You've reached your limits. Like, I can't walk down the street. I smell like urine. I'm like, oh my gosh, I'm so embarrassed. And it's like, I'm done. Let's fix this.
Right. And so some of those fixes are surgery, and what other options might there be?
I'm not finding a lot of medications that work well for urinary stress incontinence by any means. But you can try. And again, some of the laser, I guess they look like lasers, but they can really help with the constricting of vessels, getting the muscles, giving a workout to the vaginal muscles. The bladder itself, if the ligaments are loose, the ligaments are kind of loose, surgery would be the best way to tuck them up. But will it just go away on its own? Generally not. So something usually needs to be done.
And is it at all related? I know I've heard some people ask, is it at all related to the amount of sex you're having or not having? Does that have anything to do with it?
If it's not broke, don't fix it. But if it is, that's yeah, it can be, because if you are sexually active, you tend to have more muscle tone because of, well, depending on what you do, what your activities are. But if you don't have sex at all, yeah, it can absolutely cause more incontinence because everything gets looser and tighter. So the more intercourse you have, the tighter the muscles are, the less incontinence for the most part.
Right. So the message here is have more sex. And if you're single and solo, you can still have orgasms, and those are encouraged. And you can still do vaginal penetration in some very creative
and there's
and
lots of toys
ways.
And the people at some of these shops are very, very, very knowledgeable. I've been a consultant for them, and I'll call and say, this woman's having this and this and this, what do you recommend? And it's like, this is the product that I would use. And yeah, you can still have vaginal penetration, you can still have orgasm, you can still have all of that, and that helps the muscles constrict and build back up.
Excellent. So, and in terms of, do we need to know any more about our bladder or the physiology of what's going on here?
Just know they're delicate. And again, like, I've had women that have been riding horses until they're 80. They never have urinary stress incontinence ever. So I find women that are more pelvically athletic, that are doing a lot of walking, that are doing some running, that are doing a lot of movement, bouncing up and down, the best little mini trampolines. And that gets rid of a lot of lymph fluid, and everything gets drained. And when you bounce, it also makes you do this. So it gets more powerful. And so that will help. That's one of my first things. I don't know why I spaced on that. One of the first things I recommend is getting a mini trampoline and just get extra fluid that you might have, but it really helps strengthen the bladder because of that motion.
Excellent. We have one of those and it's a square one and I love it. We use it a lot. So that's the side benefit.
That's the side benefit. Absolutely. But that's one of the things that I recommend a lot.
Excellent. Now, I've also heard the term rectal incontinence. Might be a bit of an uncomfortable topic to talk about, but I think we should mention it in this context. What is it?
It's not uncommon at all, just related to rectal sex. Okay, so that's one of the reasons if there's a lot of rectal sex, the musculature of the rectum isn't as strong, so it doesn't hold stool back as much. And again, here I go back to one of my favorite things is the gut. And if your gut's not, oh my gosh, I have to go now, and you don't make it. There's just some stuff happening in your gut. We need to clean it up. Could it be parasites? Could it be just a lot of organisms? Can it be that you're not balanced, right? As far as stool goes, huge piece of that. And once you get your gut aligned, and there's some really good products that I recommend for that, then usually there's not as much stool incontinence. But again, I have a lot of people that say, oh, I just didn't make it home. I pooped my pants. And it's like, and it's beyond embarrassing, beyond more so than urinary stress incontinence. And it's like, what am I doing? Well, I had 4 margaritas last night. Well, that went right through you. So there's many reasons with foods that are really irritating that make your gut really inflamed. So decreasing inflammation of the gut, I think, is a big help for fecal incontinence. Again, lots of fluids to really helpful. I think that's kind of what I have at the moment for that, but it's a big deal. And you can go see a proctologist, and they can often take a look, and you should get colonoscopy whenever, like every few years, and just have them take a look and say a little bit of fecal incontinence, have them take and say, oh, I see why you've got some little blebs in there. You've got a couple of, and that's causing irritation. So.
Right. Now, I've heard you say a couple of times, drink more water. And I would imagine that many people listening to this would go, what? That seems counterintuitive. I'm trying not to pee, so I don't want to drink as much. But I think it's super important to emphasize the message that dehydration is a source of so many of our health problems, and we really need to keep hydrated. Could you comment a little bit about that?
Yes. And I would say, drinking a lot, I think is great. Half your body weight now is water, but like people getting up at night and peeing, that's another really big thing. One of the biggest things I find that stop that is if you use a CPAP, if you're snoring, because there's, and then you go, okay, I'm awake now. Maybe I'll just get up to pee. And then your bladder gets trained to empty that often. So if you don't drink a ton after like 6 o'clock at night, 7, sometimes you can sleep all the way through. But if you use a CPAP, if you snore, your partner's like, you're doing it again. You might want to look at getting a CPAP. And sometimes that just, you don't have that wake up tonight too. So decreasing fluids in the nighttime, late evening, and then just drinking during the day.
Right. And I think another important thing to mention here in this context is I suspect that some women, maybe a lot of women, feel some shame and embarrassment by any kind of incontinence. And what would you say to reassure women?
It's way more normal than you would think. And I probably have more people that have it than don't. Again, can hormones help with that? They certainly aren't going to hurt. The answer for everything, but it's one of the things that you go, if that would help. Trying different things, visiting different people. Again, also using some, how stressed are you? Do you have a lot of stress going on? Like on a scale of 10, on a 1 to 10, are you 100? And what kind of things do you do to help your body relax? What do you do so you're not just, okay, got to do this, have to do that. Just slow down and let your gut relax. Like I hold a lot of my stress in my gut, and I can feel it when it's like, okay, we got to get this taken care of. And so it's just like just breathing, find a really nice program. There's a couple classes that I know of that are really good. Sound meditation healing, fabulous. Some energy medicine healing, fabulous stuff. So I'll be talking more about that later on. And there's just lots of choices, but again, really good self-care, and just relax. And let's see if that helps at all. Because when you're really anxious, everything's tight and twitchy, and that can increase the incontinence on both fecal and urinary. There's some medication you can take or supplements that you can take for acidic. I'd say it's 50-50 whether they work or not.
Okay.
But again, try whatever works for you.
Absolutely. So again, it's about individual care, being aware of our body, self-care, taking time, making time for breathing, all of those things.
Listen to what your body's telling me. If you have a lot of bladder infections or a lot of stress, it's like, what are you, quote, pissed off about? What are you angry? And I hate to do this, what is a real shitty situation that's happening right now? And sometimes if you relate it back, it's like, oh, I get it. And then once that's identified, it goes away. Right. So it's that mind-body connection.
Wow. So any last encouragement that you'd like to leave your listener with today, Zora?
It's not necessarily permanent. There's things that we can do. It's just not a cut and dry thing. And you are absolutely not alone.
I love it. Thank you. You are not alone. Thank you for joining us today. And thanks, Zora, for sharing your wisdom with us. Appreciate it. And for those of you who are watching, check out Zora's profile on the Mind Myself website, and the link will be in the notes below. Take care.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious, and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.